Girls, girls or tea. Alright, so we're actually trying to talk about the evolution of preconception care and antenatal care. Evolution of preconception care and antenatal care. So the evolution is more of like, okay, over the years, okay, how far has this type of medical practice come? You understand? So looking at the evolution of these two types of care, you know, like you're just trying to look at how the okay preconception, like we are trying to talk about like the care that couples actually got before having a baby and after they had a baby. Like over the years, how have we improved on it, and how has it actually helped to reduce, you know, the rate of mothers dying and actually babies dying, you know. So historical roots, we say that ancient practices emphasize maternal health before conception. So Spartan regimens and biblical dietary. So if you're a Christian, you can check Judges 13, 3-4. Okay, traditional and cultural driven too. Okay, so a lot of, you know, tribes, okay, practice it at a cultural level. So modern evolution was between 1980s to 2000s. So it was a formal concept in high income countries. So mainly it was developed countries, right? The ones that were doing well. So they were the ones that were able to afford. So in World Health Organization rephrased it in 2013 and 2025. They defined this preconception care as a biomedical, behavioral, and social intervention. Okay, and this is like before pregnancy came in. Okay, just to reduce any risks of the woman losing the pregnancy. Okay, so key components is like for each time they usually emphasize that, like they usually prioritize what health assessment and screenings. They prioritize nutrition and lifestyle counseling. They prioritize the mental health of the person and to see if the person is not abusing alcohol or all those substances, drugs and stuff. So they also try to check if there's any genetic risk for the person transmitting disease conditions to their children. Okay, and if they were trying to plan up for reproduction, they always included the men too. Okay, because the issue could actually be on two sides. So historical development, early antenatal care visits involve frequent visits with minimal standardization. So in the mid 20th century, they restructured it, okay, and the visits were less, but for each visit it was much more meaningful. Do you understand? So they monitored the maternal health and all of that. So next we had the focus types, which were now practiced from 90s to 2000s. They recommended that the woman just visits 4 times throughout her time of pregnancy, but for each time she's coming, there are a lot of things they check. Okay, so they divided it across the trimesters. Okay, so 2016 model is the one that advocates for about 8 visits at least, and they don't really even call them visits, they call them contacts. Contacts, difference between contact and visit is visit you can just come and nothing meaningful happens, while the contact, you are saying you came and something meaningful happened. So in the 2016 model, it's more of like you might have come more than the 8 times, but we're saying 8 contacts simply because like at least 8 times you might have had a meaningful experience, meaningful contact. Okay, so that's why they actually even call it contact in the first place. So a meaningful thing actually happened as you came to the hospital, you know. So So they actually differentiated between contact and visit, just like I explained. Okay. So just so that preconception set the foundation for effective antenatal care. Preconception is the information the couples are getting even before they actually conceived, So together they form a care that spans adolescence, spans conception, spans pregnancy, spans childbirth, okay, and all of that. Okay. So that's what we have here for the evolution of preconception care and antenatal care.